Hi, welcome to Healthy Living. My name is Amy Bouton. I'm with the St. Tammany Health System Communication and Marketing team. We're here today to talk about men's health because June is Men's Health Month. So my first guest today is Dr. Sunil Pruitt. He is a urologist with the Louisiana Healthcare Associates, and he is also a member of our St. Tammany Quality Network. So we want to talk to Dr. Pruitt today about some men's health issues and how to prevent those, screen for those, and then what you do if you find them, how you treat those. So thank you so much for joining us today.
Oh, great being here, Amy.
Yeah, thanks. So we were talking a little bit before the show, and we were talking about your kind of your investment in the community. You've been here all of your life.
Yeah, pretty much all my life. Yeah, we came over to Covington, the North Shore area, in 1978. I did part of my grade schooling here back at River Forest Academy. It's Kehoe, France now.
Okay.
Then went to St. Paul's for my high school education. Went off for a few years to Vanderbilt, did my undergraduate studies there, but always knew I wanted to come back to Louisiana, to the North Shore, and so went to LSU School of Medicine for med school, and then hopped over to Tulane for urology.
Okay.
And now I'm back in the North Shore practicing urology.
Okay, and you followed in your father's footsteps when it comes to your clinical studies.
So, exactly. So my father is a general vascular surgeon. He's been practicing in Covington since the time we came here. And so it was always my dream to join him, and whether being a general vascular surgeon or something else, I ended up doing urology. And so we're in the same office. We have a urology side and then the surgery side. So
okay, that's wonderful. Fun. Yeah, and so I know that that's important that you are part of this community. You grew up in this community, and you probably see a lot of people you know and help people that you know.
Absolutely, and watch this community grow. It's been fascinating.
Yeah, so we are going to talk about men's health today because it's an important topic, and Men's Health Month is around the corner. It's in June, and I wanted to bring you in to talk about some of the things that you see in your practice, the most common things that affect men's health from your standpoint as a urologist.
Yeah, so some common men's health issues that we see day to day, the one, prostate cancer, low testosterone, low T is what a lot of people identify it as, erectile dysfunction, and just plain BPH, or benign prostate hyperplasia, enlarged prostate.
Okay, so let's talk about a few of those things. When you talk about benign prostate hyperplasia, is that something that, how does that affect a man's health and their ability to function day to day? And can that lead to something more serious like prostate cancer?
Well, it's not exactly linked to prostate cancer. There's two separate things. The prostate cancer is abnormal cells in the prostate that you have to treat to take care of the cancer part. BPH, or benign prostate hyperplasia, is a very common problem that men have. As you get older, your prostate grows. It starts to impinge on the urethra, which is the tube that drains the urine from your bladder.
Okay.
So as that prostate grows, it's almost like stepping on a garden hose. The flow decreases. So men will lose sleep at night. They'll have trouble emptying their bladder. You get urinary tract infections. You can get bladder stones. I mean, it can really affect your quality of life, and so you really want to catch these things early, because the longer you wait, the more unhealthier your bladder will get.
Right.
And you only have one bladder, so you want to catch it early, and you can treat those problems. Then you'll have a normal voiding or urinating phase for the rest of your life. So you want to catch it early.
How do you catch it early?
So a lot of times I'll have men, when they come in for just routine checks. And so what do? We do a PSA, which is a blood screening test for prostate cancer. We do an exam. We give them a symptom score sheet to fill out, and that really asks them about their frequency to urinate, their urgency, how often getting up at night, how their flow is. And then some flags will pop up if they're circling certain numbers where their symptom score is high. Then you want to proceed with things called a Uroflow, where you can actually measure the flow. You can have them come in with a full bladder. They'll urinate in this special machine, and we can kind of see their flow.
Right.
We do a post-void residual, or we check the residual in their bladder after they urinate. It's like a little ultrasound. We can actually measure what's in the bladder after they urinate, and if it's high, then we know there's an issue. And then we can kind of work it up. We can do an ultrasound of the prostate to see the size, do a little cystoscope where we take a look in the urethra, the prostate, the bladder, and then we start talking about treatments, whether it be medical treatment, which we usually start.
Yeah.
And then if those don't work, then we kind of advance it further to minimally invasive surgeries, et cetera.
Okay, so there's a process and a treatment. What are some red flags that a man would look for on their own? Like, what are some early symptoms that would say, oh my gosh, I need to see someone about this?
Well, a lot of them, the men may not realize it, their partners do, but getting up at night. So some men will, they're always dragging. They're getting up 4 times a night because they're not emptying their bladder. So every hour, hour and a half, they have to get up and urinate, and they're not emptying. They go back to bed, another hour and a half they get up, and then so the partners will realize a lot of times they go, look, the lights are going on, the bathroom switch is, they're hearing the flushes, all that, and so everybody's kind of not doing as well as they should be because of lack of sleep. That's one symptom. During the day, you have men who, I have lawyers who will be in court, and then they're like, look, every, certain amount of time I have to excuse myself. I have to get, and so there's different, the daytime symptoms of frequency, slow flow, straining to urinate, all those play a factor. The nighttime symptoms, so the overall health can get affected, right?
Right.
You're not thinking as good.
Right.
You're tired all the time.
Yeah.
And, then I have men who keep getting urinary tract infections. And, all these things can play a factor.
Okay, and it's not necessarily just aging if you have to get up several times a night. So just remember that. So it's a red flag.
That's right.
So let's talk about prostate cancer. Prostate cancer screenings are important, and tell us why they're important. We know, obviously, but tell us about prostate cancer and what happens when you find it early.
Yeah, so if you find prostate cancer early, and and you can treat it, you can go your whole life without any issues, right? Now, there's different types of prostate cancer. We always screen patients after age of 50. We do the PSA that I was talking about, the blood test, and then also an exam. And suppose we do have an elevated PSA, now we have options like imaging studies, like an MRI of the prostate. It's more specific for the prostate. It looks at the deep down tissue in the prostate, and if there's any abnormal lesions, then we can do what we call a UriNav MRI fusion biopsy.
Okay.
That's done at St. Tammany. We have the equipment, the technology. The hospital was very, agreeable early on when all this technology came out to get this, to offer it to the community, and it's made a big difference. So we can catch these things early. If patients come in for their routine screening, it should be a no issue.
Right.
Now, the last thing I like to see is when a patient who's otherwise healthy comes in with back pain, say, and his primary care ended up doing a PSA, and he's got a very high PSA. And then we do a workup, and guess what? The prostate cancer is spread to his bones, his skeletal muscle. I mean, the skeletal bones in a lower back or what have you. Then that becomes a difficult issue. I mean, you could be a healthy person, 60 years old, even in your 50s, and next thing you know, you got metastatic prostate cancer. So we're trying to avoid that.
Right.
And I think if people go for the screenings, I think most of that can get alleviated before it even starts. You can kind of catch it early.
Yeah. Well, we're going to let you go in just a minute, but I wanted to ask you one question. We talk about men's health, and we talked about this also. We think of older men. What do you want to say to the young men about their health now, 20s, 30s, 40s? What should they be doing to protect their health?
I think, for urology, most of the issues that we have are as you hit the 40 plus years of your life. But, I have patients with urinary tract issues where they get infections. It could be something as simple as a stricture in the urethra. I think people just need to pay attention to how they're voiding, how they're urinating, what their symptoms as far as that goes, make sure that their flow is good, make sure that if you have a family history of prostate cancer, at least get a baseline PSA and an exam at age 40. Those are the things. Just be aware of your body. I think that's a big part of it for the younger years.
Okay, well, thank you so much for joining us. We appreciate you being here, and thanks for all this wealth of information. We appreciate that as well. Again, you can find Dr. Pruitt at Louisiana Healthcare Associates. So if you need any screenings, if you are having any early symptoms, please get in touch with Dr. Pruitt, and we will be right back.
Innovative healthcare isn't just about robots. It's about people. And world-class healthcare requires a world-class team. We're constantly implementing innovative programs designed to develop and mentor the best and the brightest. We take care of our team so they can take care of you. The St. Tammany Health System team is going places, and our patients, well, they're going home.
Welcome back to Healthy Living. We are back to talk a little bit more about men's health. And I have with me, Bert Lindsay. Bert is our Director of Acute Rehab Services and Patient Mobility for St. Tammany Health System. And we're excited to have you here, Bert.
Thank you for having me.
Thank you for coming. We're going to talk about something that you're very passionate about. But first, I want people to learn a little bit about Bert.
I'm a damn Yankee. My dad was in nuclear power. We moved every 4 years. And when I was in the 8th grade, we moved to St. Francisville.
Oh.
And I had a bowl of chicken and sausage gumbo, and I told them right there, I'm never leaving.
Never looking back.
And I got emancipated. They went to Illinois, and I've never left.
Oh, good.
Married
Glad
a
to have
Cajun,
you here.
There I am.
Good. So what do you like to do? I mean,
I do a lot of things. I woodwork, I play music, but really my passion is still MSK ultrasound. I live and breathe it.
How long have you been with the health system?
I came here in 2012.
Okay.
I left after Katrina and did a walkabout and came back.
Okay.
This is right where I needed to be.
All right. Well, we do want to talk about men's health. And we have an event that's coming up, Man Up for Men's Health. It's Friday, May 31st. And you guys your team goes out to so many of our outreach events.
We really do.
With the musculoskeletal ultrasound,
exactly.
MSK ultrasound.
That's it.
So tell people, what is it, first of all?
So MSK ultrasound is a subset of the regular other ultrasounds that are around. It uses the same equipment you would do to assess for pregnancy or for a gallbladder or vascular systems. But what we look at is soft tissue, specifically muscles, tendons, joints, ligaments, and things of that nature. The beautiful thing about it is currently, if you get an x-ray and it's negative, you go to a therapist, an orthopedist, or a trainer, and they'll do special tests and maneuvers to stress things, but you're really only 50 to 75% sure of what you're looking at. With the advent of musculoskeletal ultrasound, a trained clinician can see everything that's in there. So if there's no fractures, we can see tears, strains, ligament tears, bursitis, soft tissue issues. We trace nerves regularly to see if there's any issues with nerves, neuromas, schwannomas, things of that nature.
So if you get an x-ray, you see the bones, right? If you get the ultrasound part, you're seeing what you said, the soft tissue. Your treatment path could be different, right?
Yeah, absolutely. The goal of the program for us, came out of the opioid initiative. So we were really strong into opioids, and the best way to stop opioid abuse is to just stop all exposure. And if you go to a physician or a family practice doctor or a trainer and they can't find a broken bone, you may be set on a course of opioids. And it may go on for several weeks because insurances do not like to authorize MRIs unless conservative treatments have failed. And unfortunately, opioids are considered part of those conservative treatments. So if we can get, in conjunction with a negative x-ray, some more material to the physicians, they can make a better decision on a course of action for treatment.
Right, especially if it is in the soft tissue.
Absolutely.
So we've talked about it so many times, and I've had an MSK ultrasound painless and fast, and you can see it. You can tell me in real time what's going on then and there.
And one of the other things we can do that you can't do with MR or CT is we can do video clips. So we can dynamically stress joints, move joints through the whole motions so that we can see things that sometimes people can't see. We can see any issues 2 millimeters. We can see structures 2 millimeters or less apart.
Golly.
So we can see a lot of stuff.
So when you talk about the MSK ultrasound as that next step, so if you have an x-ray and it's negative, how would you tell your physician, hey, can we try this instead of that? So can I try this treatment, this diagnostic tool, MSK? How would you do that?
So we've been training all the physicians. We have the order sets in all of our facilities. But you would just call them, and then, or when you discuss with them, just say, I've heard that we have this new ultrasound that looks at soft tissues for muscles and tendons, and it's called musculoskeletal ultrasound. And we do it in our outpatient clinics. Mike McNeil and his staff do a phenomenal job doing MSK ultrasound there, and we can do it in the acute setting. We can do it from our outpatient facilities in the hospital. We'll come down there and get the patients, and we just do the scan. As you said, it is painless. There's no restrictions for it, and it's a very cost-effective tool. And this way we can help appropriate if you need further imaging. And as I said, I tell the doctors all the time, we're just another advanced tool in your kit. We're a power tool, so to speak.
Right.
And because that's what doctors need to make informed decisions. So, and they're really taken to it. It's such a new concept. There's only 12 or 13 people in the entire state that are certified, and right now 7 of them work for us as therapists, and 3 more have just taken their boards.
So we have a little power team of our own.
We're concentrated in this area, and our goal is to get into men's health, women's health, sports, kids, club ball, all that. So, because it is very effective, and as you said, patients absolutely love it, because if they think they have an issue and an x-ray is negative, they feel like that maybe that it's not being taken seriously. But once they see it, even if it's just a small issue, then they get validation that they did in fact have a problem, and that's what we want. We want patient satisfaction.
And we have talked about in the past also that it saves you time, and time for me, that is truly the most valuable asset that I have. And how does it save you time? We went through it in pieces and parts, but tell people why it is a time saver, why it makes your treatment plan, possibly could make your treatment plan more efficient.
So we'll use the ER as an example.
Okay.
So when people come in and get a negative x-ray at ER, they'll call us and we'll come right down. Our scans take no more than 15 minutes. And then we can show them and the physician right there what the issue is. That way we can set them up immediately with we have some fantastic physicians and therapists at St. Tammany Health System. We'll set them up immediately, and within 2 to 3 days they're now being seen with more enhanced knowledge of what's exactly going on.
So you don't have to wait for that x-ray to come back, or you saw the x-ray come back.
Right.
Okay, so you don't have to start physical therapy and wait to see, okay, if I do physical therapy, does it make it worse or does it make it better? You can say, okay, let's look deeper. Instead of just looking at the bone, let's look at the soft tissue too and rule that out.
Exactly, and a new aspect of it that's catching on across the country, specifically for therapy, is once you start to do treatments, you can use follow-up MSK ultrasound images to show the healing process.
Oh, wow.
It's also, all insurances pay extra if you use MSK ultrasound when you're doing injections, because they will know that you know where you're going with the injection.
So you can see your progress and know when you need to stop.
Absolutely.
You know, just treat and treat and treat.
Right, and you can get authorization for further visits if needed, because you've got extra baggage to show them.
Yeah. So why do you and your team go out and do the events that you do?
Because it's such a new technology, people don't know about it, and you've been there. When people see what they see, it's so much fun to see people see what's going on in their bodies. And I've been doing this for over 30 years, but I never really had the grasp of anatomy until I started this 5 years ago. Because everybody's different, but you get to see things that other people don't. But I, as an educator, it's phenomenal to watch people, especially when you find things that they know that they had, but they didn't know what it was.
Well, I think that is an important part of this too, because you said it. When you know that something's going on, but no one can find it.
Right, exactly.
When someone finds it, it's validation that, okay, it's not all in my head.
That's exactly right.
It's not something I'm moving wrong, or no, it's an actual issue that we can address now.
We've had people come to our hospital for multiple ERs, having multiple radiographs, and they'll get a scan and they'll go, I knew something was wrong with me. And it's non-invasive, and as I said, it's very cost-effective.
Non-invasive, cost-effective. Talk to your insurance provider for sure.
Absolutely.
Talk to your primary care, your orthopedist, whoever you're seeing, ask them about it. So how would someone get in touch with your team?
They can either call the hospital Our direct extension is 898-4424, but if you call the scheduling line for radiology or you call the outpatient clinics, all of our schedulers know that the service is provided.
Okay, gotcha.
And there's, right now, as I said, there's 7 therapists, PTs that are doing it. There'll be 3 more in 2 months, Lord willing. And then we'll have 10 total, and we're going to be everywhere. And we love the events because the units are portable.
Yes.
We actually have handheld units. We can look right on our cell phones and show you images right there.
It's amazing.
Its technology is phenomenal.
It is phenomenal. Well, thank you so much for coming in and sharing that with us.
Always a pleasure.
And look for Bert and his team at the Man Up event at the Covington Beer Garden, May 31st from 5 to 7. We hope you'll go out there and see Bert. We are going to be right back, and we're going to talk some more about men's health, so stay tuned.
No bones about it. St. Tammany Health System's Bone and Joint Clinic is #1 in orthopedics. Along with our partner, Ochsner Health, we connect you to the very best care. Not just on the North Shore, but in the country.
Welcome back to Healthy Living. So we're going to pick up our topic of men's health again, and now I have with me Alyssa Ard. Alyssa is an ultrasonographer with St. Tammany Health System. Thank you for coming in today.
Of course, my pleasure.
Good to see you.
You as well.
So we are going to talk about men's health. We're going to talk about what you do, and it really applies to men and women. But since we're focused on men's health, we'll we'll speak to it from that angle. But let's tell people a little bit about Alyssa.
Yeah, so I'm an ultrasound tech with St. Tammany Paris Health System. I'm from Walker. Also in the military. I'm in the Army National Guard for Louisiana, and in my free time I like to do CrossFit. I like to play beach volleyball, just kind of stay active.
Yeah, so there's a lot going on with Alyssa. She's a phenom, so we're happy to have her, and we're happy to have you here to talk about this because you have such a wealth of knowledge about it. So carotid ultrasound screenings,
Yes.
Why are those important?
So they're important because plaque can build up in our arteries due to like high cholesterol, and that plaque buildup can cause blockage of flow to the brain, which is what we don't want, because poor flow to the brain is something that can cause a stroke.
Okay, so where is the carotid artery for people
So
who might not know?
You have 2. They're on each side of your neck, so blood flow from the heart to the brain. So yeah, it's just important to make sure that flow is wide open, and you don't want anything like that to happen, because it's one of those things. It might start off with like dizziness, loss of hearing, vertigo and stuff, but when it hits, it's kind of late. So people who have no clue that they have anything going on in there, doing a screening is good, because otherwise they don't know till it's too late.
So tell us about the screening itself.
So the screening itself, it's just like Bert said, it's normal ultrasound. It's vascular, so it's warm gel on each side of your neck. We are looking at the pulse. We are looking at different views of that artery to make sure it's wide open. We also Doppler the flow of your internal carotid artery to make sure the pulse isn't too high, because maybe we see plaque buildup that's causing a block, and it's indicative of a piece could break off.
Okay.
And if that piece breaks off and floats up, so we can only go so high, we can't penetrate through the bone, but if that pulse is very, very high, once we start Dopplering up towards the brain, then we could be like, oh, that's a problem. It's indicative of carotid artery disease, which we don't want.
And then you would recommend for the patient to see someone else about that.
Yeah, so this is just a screening. People ask all the time, does this go into my MyChart? And I'm like, we don't save images. It's just a screening. But if it's a concerning scan, we'll tell you, go to your doctor, let them know, and they can order a diagnostic ultrasound in which we do the entire carotid very thoroughly, Doppler the entire thing, take lots of images, and then a radiologist will read the exam and write their report on it to give them like a baseline.
So when would a doctor recommend that for someone? When would my primary care say you need to go get your screening?
So whenever they listen to your pulse, so they might touch their 2 fingers to your neck and they feel a bruit, which is just like an abnormal pulse, or if you go in for complaints of vertigo, dizziness, headaches, and things like that.
Okay. Now, we've talked about this plenty, about, your carotid artery, it goes to your brain, it goes to your heart. So it can affect lots of things in your body.
It's a big thing with heart health, the whole vascular system. Like I said, it's all about cholesterol. So high cholesterol, the kind of food you eat and everything. And people also ask, is there anything I can do about it to like make it go away? once you have a little bit of buildup, you can't necessarily make it go away, but you can prevent it from furthering. So that's lowering your cholesterol, lowering your blood pressure, eating healthy, staying in shape, like exercising, keeping your weight down, especially if you're a smoker, stopping to smoke, that's a big one.
Right.
But let's say that I'm scanning you and I do find a blockage, and I can hardly see flow, and the doctor's like, we really need to get this taken care of. They have an in-arterectomy. It's kind of like a roto-rooter for your artery. They're going to go in and they're going to clean it out.
Okay, so that's important for you to say, because we've talked about this also. Lots of people avoid screenings altogether because they're like, I'd rather not know what's going on.
Yeah.
So that's one way to look at it. But if you do get the screening and we can do something about it, then you've prolonged the health of that artery.
Yes, a lot of people sit in front of me and tell me, I'm scared or I don't want to do it. I'm like, you want to do it because when you know and you're not feeling symptoms, you can get taken care of, versus, like I said, when it's too late and you have all these problems, it's a lot harder to take care of.
Yes. There's also a beneficial byproduct of the screening that we've talked about. And what is that? Tell people what is a secondary benefit.
So your thyroid is a butterfly-shaped gland at the base of your neck. It's in charge of different hormones, mainly metabolism, but different body functions. And so while ultrasound cannot detect function of the thyroid, we can look at the just the anatomy of it. So anatomically, it's situated next to our carotid right here in the middle.
Okay.
So we can see like the texture of it. We can see cysts. We can see nodules. And I have had people sit down and we find a nodule that, to my eye, I know that's not what it's supposed to look like, normal versus not normal.
Right.
And so that's when I say, you know, your carotids may look great, but I really think you need to go tell your doctor that we found a nodule and that they need to look at it. And people have come back that I've scanned, they're like, oh, I did this last year, they found a nodule and it was cancer, and like it saved my life, like thank you so much. So it's a really cool thing that I can do, and that's the cool thing about all ages. So they recommend carotid screenings around the age of 55 when you get a little older.
Yeah.
But even for young people, it's good because, one, if you have a family history, it's always good just to check. But two, you, again, young and healthy carotids, but your thyroid is, you wouldn't even know it because you just didn't. It's not till it's too late that you realize it.
Right. So again, I've had the screening at our Ladies Night Out event. You guys are going to be at the Men's Health event on May 31st. There's nothing to it.
No, it's so quick and it's so easy, and it's fun. I like to let people look at the screen while I do it. I feel like it gives them a peace of mind. I kind of like to teach as I go, and they always tell me, thank you so much. It made me feel way better, and it's really cool to see that ultrasound has a lot of different avenues.
Yeah, so if you guys are going to go out to Man Up, check out Alyssa's team. She'll be out there. Well, she won't be out there. Her team will be out there. But is there anything else you want to add about the screening itself, the importance of the screening, anything people should pay attention to or ask you about when they're getting screened?
Kind of like I said, just don't be afraid to do it. A lot of people are scared. Don't be scared. It's good to know. I've found stuff before, and maybe it's not cancerous, or maybe it is, maybe it isn't, but it's always good to go ahead and know, and don't be afraid to ask any questions. It's just a screening, it's not diagnostic. We're only going to give, so much of our opinion because a radiologist who is certified does need to read it.
Sure.
But we will be honest with you, and if we think you need to see someone, we're going to tell you. We're not going to hide any information from you or anything like that. People are like, are you going to tell me what's wrong? Yes, we will let you know what you need to do.
Yeah. Okay, well, thank you so much for being here. I appreciate you coming out and sharing your knowledge with us. It's always good to see you.
You as well.
So thank you all for joining us for Healthy Living. That's going to do it for us today. Thank you for watching, and we will see you next time.